My name is Dr. Linda Snetselaar, and I am Editor-in-Chief of the Journal of the Academy of Nutrition and Dietetics. And today we're discussing multiple vitamin mineral use in children. With me is Dr. Johanna Dwyer. She is a professor of medicine, nutrition, and community health. She is also adjunct professor at the Friedman School of Nutrition Science and Policy, along with serving as senior scientist at the John Mayer USDA Human Nutrition Research Center on Aging at Tufts University. She directs the Francis Stern Nutrition Center at Tufts Medical Center, and her work additionally involves service as a senior nutrition scientist at the Office of Dietary Supplements, National Institutes of Health, where she is a contractor. Welcome, Dr. Dwyer. I have a few questions for you on the topic of multiple vitamin mineral use in children. And I'll start with the first question. Has caregiver behavior in terms of giving young children multiple vitamin supplements changed over the past 5 years? And if so, how?
Oh, good question, Linda. The answer is we don't really know because of COVID. Most of the data we get is from the national surveys. I can tell you what we suspect. According to most of the past surveys that have been done over the past 10, 15 years, if we look at young children, 2 to 5, about 35% of them use multivitamin mineral supplements. I don't think there's information available for this age group in the last couple of years because of COVID. But I'd suspect, if anything, that supplement use probably did increase a bit, but probably not multivites as much as single supplements because people were worried about COVID and so forth. But we really don't know for sure. For dietitians who want more on that whole issue of the COVID, Office of Dietary Supplements at National Institutes of Health has a really good fact sheet on that for health professionals such as those of us on this call. But there's another one in for consumers, and they're all free. You just go to the website and download. So that's where we stand as of today.
Okay, thank you. COVID is seeming to affect every aspect of our lives.
Oh,
What are the most common multiple vitamin mineral supplements that are given to young children today?
well, about a third of children and adolescents from, say, age about one to up to 17, 18 years of age take multivitamin mineral supplements. If we look again at Hanes, most of the supplements they're taking are multivitamin mineral, and that's been true for many years. If we look at young children, 2 to 5, it's about 45% in the most recent surveys we have that were done about almost a decade ago now. But we found that most of the kids who used dietary supplements did use these multivites or multiminerals. The difficult thing about them is, there's no standard definition. So some of them contain botanicals, some contain different amounts of supplements, and it's a little tricky to get it exactly what it is. But usually they're nutrient supplements.
What is the largest concern in terms of giving young children multiple vitamin mineral supplements?
Boy, that's a good question. Well, I think the largest one, I've got several concerns, but certainly the largest is, does what's in the bottle fit the micronutrient gaps in needs that remain after food intake alone? Because that's what supplements are supposed to be. That's the big one. Now, the problem is that those, as I said, multivitamin mineral supplements are a whole bunch of different things. And it's a little hard to get a grasp around them because there's no common definition the way there is for a lot of other products on the market. So our concern is that the products may not be formulated to fill the gaps in children's needs after what they get from food. Some micronutrients may be needed, but they may not be present in the amounts great enough to fill the gaps. and some other micronutrients might already be present in ample amounts from what kids are already eating. And that's what we found when we looked at a large number, in fact, all of the supplements we could find for young children 2 to 5 years of age. So that's, I think, the biggest concern. Vitamin mineral supplements aren't going to cure getting too much sodium, getting too much added sugar, getting too much saturated fat, getting too little fiber. So we have to think of food first. I've got a couple of other concerns, though, Linda, in terms of giving kids multivitamin mineral supplements. Sometimes we worry about whether what's on the bottle, labeled on the bottle, is what's in the supplement. And I think we can be pretty sure, for the nutrients at least, the micronutrients, from a large study we did at NIH in collaboration with colleagues at U.S. Department of Agriculture, that usually the amounts of nutrients are at least as much as is listed on the label. That isn't necessarily true for all of the other things that are in the supplements, like botanicals in some cases, but those are not needed by human beings. They're just in there. The other final thing for very tiny children is I do worry about bottles being out of reach of children. You know, some of the gummies look very attractive, they're bright colored. So you want to make sure it's put up high where the kids can't get at it.
Where can people acquire more information about MVMs for children?
Well, there are a number of different places. The first thing I do is look at all the position statements of the American Dietetic Association. I'm a dietitian. A second good source, I think, because especially for young children, they're generally the parents are usually in touch with the family physician or pediatrician, and so I find that the American Academy of Pediatrics has some good position statements on this as well. And so I think it's always a good idea to take a look at what the Academy of Pediatrics has to say too. And as I remember, a couple of months ago, there was a good article. I think it was the Kids Eat Right that the Academy of Nutrition and Dietetics put out. I think Esther Ellis was the author there, and that was a good article as well. So those are three sources, and then of course there's Office of Dietary Supplements. We produce, I think, very, very good materials, both in English and in Spanish now, which are fact sheets. And there's a fact sheet on multivitamin mineral supplements that might be helpful as well.
This question, I think you've already touched on, but when we're looking at a label, how do we know what's listed on that label is actually what's in the bottle?
Well, that's a question we asked about 15 years ago because we didn't know. You know, there hadn't been direct chemical analyses of the supplements to see what was in the label was the same as what's in the bottle. And so what we did was we teamed up with the Department of Agriculture chemists, and we took, or agriculture actually did this work. We did a representative sample of all the most common supplements in the United States, which by far are multivitamin mineral supplements. And we looked at child supplements, and we also looked at prenatals, and we looked at adult multivites. And what they did then was they took samples of these, you know, they went out and just bought the samples and then had them analyzed chemically in a contract laboratory, and then produced the results. And we've got a whole series of papers on this. And it's true that the range of nutrients in the supplements varies, but in general, it's pretty much in line with what's on the label. There's some deviance, but usually you get at least as much as is in the label, on the label. That's for the nutrients. When you get into the botanicals and all of those other things that are in there, we haven't spent the time or money to look at that because we're mainly concerned with the nutrients that we know people need and maybe taking these supplements to get. So I think we can be assured pretty much that what's on the label is what's in the supplement. The additional question is what's on the label what people need? And that's another question entirely. For example, in a study we did looking at prenatals, until recently, there wasn't iodine in those supplements, and that's changed. The industry has started putting iodine in the supplements for prenatals, and that's important because some women are a little low in their iodine intakes. So that's good news.
Johanna, could you tell us a little bit more about dietary supplement use, particularly in food insecure populations, including children and adolescents? That's a huge topic today, and wondered if you could shed some light on that for us.
I'd be happy to. Let me just make a couple of comments. The first is that if you do a survey of all people in the United States, all kids and adolescents, they come out pretty well in terms of micronutrients intakes. The problem is that the kids in the lowest income group, the poverty income ratio is the way the government measures that, are really not as well off as those in the highest. And they're least likely to take multivitamin mineral supplements that, at least for some nutrients, might be helpful in increasing their intakes of those nutrients. So there really is a problem there. The wrong people are sometimes, or not, the right people aren't necessarily taking the supplements. The work that I think is really key on this has been done by two wonderful graduate students who were at Purdue working with my colleague and good friend, Reagan Bailey. One of these gals, they both have their doctorates now, I think, is Dr. Chun-Young Jun, and the other is Alex Cowan. They've done some studies using the Haynes data, and what they've found is that food insecurity among U.S. children using Haynes data, the latest data we had was up to about 2016, and looking at kids from age 1 up to 18, food insecurity was associated with lower income families having lesser use of supplements. It went from, like, in the lowest poverty income group, 22% used these supplements, up to about 45% in the highest. And when kids' families had no health insurance, again, it was much, much lower. So there are kids who could benefit. It's unfortunate that they are not getting the supplements in some cases.
And finally, when counseling caregivers of young children, what should RDNs be addressing with regard to multiple vitamin and mineral supplement use?
Well, I think in general, and I'll give you some specifics where I don't think this is true, but in general, most kids who eat a well-balanced diet don't usually need a vitamin or mineral supplement. And that's something that the Dietetic Association, or the Academy of Dietetics, but also the Academy of Pediatrics and the dietary guidelines would all pretty much agree with. However, the first thing to emphasize then is it really does need to be food first. And the rule is to think of food first and then supplements second, and not the other way around. The second thing is there are a few kids who might need to be further assessed to see if they might benefit. And because dietitians are seeing a whole range of people in terms of their health status, we have to think about them. Now, the first ones that everybody always thinks about is vegans and vegetarians. And it's true that some of those folks in that category may need a supplement that provides B12 if they're vegan, or others like vitamin D if they're low in plant foods, and minerals like iron and calcium that aren't as bioavailable. Of course, that's true. I think most dietitians already know about that. But there's some other groups as well. One is children who are on very restrictive diets, such as dairy-free, gluten-free, other very restrictive diet, the FODMAPs diet that is popular, at least in some quarters. A child with various digestive problems or other problems like celiac disease, liver disorders, other diseases that are going to give rise to malabsorption, or children who are chronically ill, particularly with diseases that affect the gastrointestinal tract. I think they might also sometimes benefit from a supplement because they're in and out of disease condition and they may not be getting all they need. The other group that unfortunately we're seeing a lot of these days, I think in our practices, is children and adolescents, particularly adolescent girls, but some boys now too, who have eating disorders or who are extremely underweight. Now, sometimes this is just the eating disorder itself. Sometimes maybe there's underweight due to some other illness, and a physician might suggest that a supplement would be good there. And then, of course, sadly, this is unheard of, at least when I first went into dietetics. There are some adolescents who had bariatric surgery, and particularly the more restrictive, where the surgery is really very extensive. Those people are going to need supplements of many of the fat-soluble vitamins and minerals because they're malabsorbed for the rest of their lives. So for them, special preparations are going to be needed, and a multivitamin mineral supplement isn't going to do the trick. So it's critical that individuals like that be sure to get the supplements that are right for them. And finally, overweight and obese children in weight loss programs might also be prescribed a multivite. And a child who's on chronic medications of any sort, I think it's wise to check with the physician and then also with the clinical pharmacist to make sure that there aren't any interactions with the medications. That's basically some special cases for professionals who are dietitians where there might be a need for these. And finally, just because there may be a need for a multivite doesn't mean that giving twice as much is going to be twice as good. That could lead to excess, and that wouldn't be a good idea either. There's one other group I didn't mention, and that is kids who have behavioral disorders where they're on and off of, they go on food jags for like a month where they'll eat only popcorn or whatever. I think they're right in that case too. I think might be a good idea to have a multivitamin mineral supplement.
Thank you so much. Wonderful information, and importantly, you tie evidence to the information you're giving us, and that is so critically important. And this particular topic is one that I think will continue to be very important as caregivers, RDNs, work with patients on a daily basis. So thank you so very much.
You're welcome.
And I appreciate the time that you're giving to us today. Thank you.